So Henry is a 50 years old male that had Down syndrome, which means his brain functions or his understanding is of 3 years old. And Mater Refugees Complex Care Clinic was the one who referred them over to us. At the time, he was needing very urgent care for the front tooth. It was very painful, and there's no way for him to express it as well. But the family unable to pay for him privately, and he's not eligible for public as well. He would have been just left at ease to keep suffering.
The clinic itself, we see it as being the place where people can be referred in, and doesn't matter where they're from or what their current status. If they have barriers and if we cannot assist them to seek help in the mainstream service, we will try and provide them the service there at the clinic.
Micah and Sushi, I think, align through a compassionate response and a response that recognises structural disadvantage and inequality. Everybody agrees that there is a huge gap in how people access dental care. So what Tushi does is incredibly important.
Henry required a special needs dental specialist. So these people do care for patients with complex medical conditions that a general dentist is unable to look after. We were very lucky enough to have Dr. Lydia.
I'm a specialist in special needs dentistry, and it's a field of dentistry that deals with our special needs population. We have a particular interest in helping those with physical and intellectual disability, medical complexities, and those with psychiatric conditions. But what is different about special needs as a specialty itself is that not only do we deal with the dentistry, but we also deal with the patient as a whole. The type of patients that we see are those that really need the dentistry, the dental work, because they very rarely get access, and also their dental conditions are a lot worse, whether it's because of their disability or their medical complexity or the psychosocial aspects. They can't get access to care. What we're looking at is looking at the patient and what we can do to continue to give them a good quality of life. I think that really does resonate with what the model of care of medicine and healthcare is going at the moment as well. And Tzu Chi was already pushing this back in the 1960s, 70s when it was starting up with the medical mission.
So bringing back that, I guess, holistic model of healthcare and really bringing it into life is what we always hope to make happen.
After a few years of operating the clinic, we find that our volunteers, through conversations with patients, they've actually been able to pick out other needs of the patient, and then we try to then introduce other wraparound service to help the families.
For example, in Henry case, started from Inclusive Health Clinic dental needs, and then we find there's financial struggles going back to charities. Then we identify there's more functional assistance required and allied health being engaged, and then also the emotional well-being support, where the sister or the mother will need more time to relax with all the stress to manage at home, and that's kind of how we really related them back into the acupuncture side of things. So it's a complete circle, and it's also the principle of care of the foundation, a whole person, whole family, whole journey. So it's bring the whole teams together to make sure the patient is well looked after.